Cytovene Vial, also known as ganciclovir, is an antiviral medication used to prevent disease caused by a virus called cytomegalovirus, CMV. This is especially important for people who have received organ or bone marrow transplants, as CMV disease can lead to serious infections in the body, including an infection in the eye, called CMV retinitis, that can cause blindness. It is also used to treat people with weakened immune systems, such as those with AIDS, who have CMV retinitis. Cytovene Vial works by slowing the growth of the CMV virus, helping to control CMV retinitis and decrease the risk of blindness. It also helps prevent the spread of infection to other areas of the body. It's important to note that Cytovene Vial is not a cure for CMV disease, and some people may still experience worsening CMV retinitis even with treatment. If you are prescribed Cytovene Vial, it is important to have your eyes checked regularly by your doctor. The dosage and timing of this medication will be determined by your healthcare provider based on your individual condition and needs. This medication is administered through a vein over a 1-hour period. It's important to follow your doctor's instructions and not to speed up the process, as this can increase the risk of side effects. The dosage and length of treatment will be based on your weight, medical condition, and response to the treatment. Remember to drink plenty of fluids unless directed otherwise by your doctor. If you're using this medication at home, make sure to learn all the preparation and usage instructions from your healthcare professional. Before using, check the product for any particles or discoloration. If you notice any, do not use the liquid. When handling the medication, wear gloves and avoid direct contact with the liquid. If it comes into contact with your skin or mucous membranes, wash the area thoroughly with soap and water. If it gets in your eyes, rinse them with plain water. Properly store and discard needles and medical supplies, as special disposal is required for this medication and its injection supplies. Use this medication at evenly spaced intervals and at the same time each day to maintain a constant level in your body. It's important to continue using the medication as prescribed by your doctor and not to skip any doses, as doing so may worsen the infection. If your condition worsens, be sure to inform your doctor. Some common side effects of Cytovene Vial may include diarrhea, upset stomach, dizziness, drowsiness, unsteadiness, shaking, or pain/redness/irritation at the injection site. If these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects, such as mental/mood changes, like confusion or hallucinations, signs of kidney problems, like changes in the amount of urine, or seizures. While serious allergic reactions to this medication are rare, seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, please contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Cytovene Vial, also known as ganciclovir, may have some serious side effects. It can decrease bone marrow function, which may lead to a low number of blood cells and cause anemia, decrease your body's ability to fight infections, and cause bleeding problems. Your doctor will monitor your blood tests and adjust your treatment to reduce these risks. If you experience signs of anemia, infection, or bleeding, seek medical help right away. It's important to note that Cytovene Vial may reduce fertility in both men and women and may harm an unborn baby. If you have concerns about this, be sure to talk to your doctor for more details. Additionally, Cytovene Vial has caused tumors in lab animals, and although there is no information on humans, it should be considered potentially cancer-causing. Be sure to review the how to use and precautions sections for more information. As always, it's important to follow your doctor's dosage instructions and to take Cytovene Vial at the optimal time for you. Before taking Cytovene Vial, make sure to inform your doctor or pharmacist if you have any allergies to ganciclovir, ganciclovir, acyclovir, or any other substances. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. You should also let your doctor or pharmacist know about your medical history, especially if you have kidney problems, a low number of blood cells, or if you have undergone radiation treatment. Cytovene Vial may cause dizziness, drowsiness, or difficulty thinking clearly. It's important to avoid alcohol or marijuana, as these substances can worsen these effects. Do not drive or operate machinery until you can do so safely. Limit alcoholic beverages and talk to your doctor if you are using marijuana. This medication can increase your risk of getting infections or worsen current infections. It's important to stay away from anyone with a contagious infection such as chickenpox, COVID-19, measles, or the flu. If you have been exposed to an infection, be sure to talk to your doctor for more information. Inform your healthcare professional if you are using Cytovene Vial before receiving any immunizations or vaccinations. It's also important to avoid contact with people who have recently received live vaccines. To reduce the risk of injury, be cautious with sharp objects like razors and nail cutters, and avoid activities such as contact sports. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be at a higher risk for kidney problems while using this medication. Pregnant women or women who may become pregnant should not handle Cytovene Vial. If you are pregnant, this medication should only be used when clearly needed, as it may harm an unborn baby. Women of childbearing age should have a pregnancy test before starting this medication. Men with female partners should always use effective barrier protection during sexual activity while using this medication and for at least 90 days after stopping it. Women of childbearing age who are using Cytovene Vial should also use reliable forms of birth control during treatment and for at least 30 days after stopping the medication. Be sure to consult your doctor for more details. It is not known if this medication passes into breast milk, so breastfeeding is not recommended while using Cytovene Vial. Be sure to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Cytovene Vial, as they can affect how the medication works and increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription/non-prescription drugs and herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Cytovene Vial include didanosine, imipenem/cilastatin, and maribavir. If you are taking other drugs that decrease bone marrow function and lower your number of blood cells, such as cancer chemotherapy, trimethoprim/sulfamethoxazole, or zidovudine, or other drugs that may cause kidney problems, such as cyclosporin, your doctor or pharmacist will monitor you closely and adjust your medications to decrease your risk of serious side effects. It's important to note that ganciclovir is very similar to valganciclovir. Therefore, do not use medications containing valganciclovir while using ganciclovir. Always follow your doctor's recommendations for the best time to take this medication and the appropriate daily dosage. If someone has taken too much Cytovene Vial and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share Cytovene Vial with others. While using this medication, it's important to have regular lab and/or medical tests, such as a complete blood count, kidney function tests, and eye exams. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you happen to forget a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take your next dose at the usual time. Avoid taking double the dose to make up for the missed one. Make sure to consult the product instructions and your pharmacist for storage details. It's important to keep all medications away from children and pets. When it comes to discarding this product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Make sure to properly discard this product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.